Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So, let's take a look.
Today, we're going to talk about Synalar Simple, also known as fluocinolone acetonide. If you have skin problems, your dermatologist might have prescribed it to you. Synalar Simple is great for treating conditions like dermatitis, eczema, and psoriasis. It's also helpful for allergic reactions that cause skin problems. Basically, if you have swelling, redness, or itchiness, this medicine could be the solution. So how does it work? Synalar Simple is a corticosteroid, which means it reduces swelling and redness. When you apply it, you'll notice that the discomfort and symptoms get better. To use it correctly, apply a thin layer to the affected area once or twice a day, as your doctor has told you. Unless your doctor tells you to, don't cover the treated area. At first, the dose might be higher and then reduced to maintain the results. Like all medications, Synalar Simple can have side effects. The most common ones are burning, itching, or mild irritation where you apply it. In rare cases, more serious effects can occur. That's why it's important to follow your doctor's instructions and let them know if you notice anything unusual. Remember, don't use Synalar Simple for longer than your doctor tells you to, and avoid applying it to sensitive areas like your face, armpits, or groin, unless recommended. In short, Synalar Simple is a very useful tool for treating skin problems. Follow your doctor's recommendations and keep an eye out for any changes in your skin. Thanks for watching this video. Take care of your skin and see you soon.
If you've made it this far, let us know in the comments why you're using this medicine.